Hello, good evening. Good evening, good evening. Can you guys hear me?
Yes, I'm sorry.
Oh,
Hi.
thank you. No problem. Okay, so let's see. Let's give a couple of more minutes for some of students to join the class. Five is five. Okay, a couple of more minutes and then we can start the class. Any questions, anyone? Okay. Once again, we're just giving a couple of minutes to other students to join the class, and then we can start. Okay. Good evening, everyone. For those who just joined the class, let's continue with this lesson number 9. We're going to talk about patients billing and collections. Before we start the class, anybody has any questions up to now about anything related to the class? Okay. If you have any questions, just don't forget to let me know at any time. Okay, so patient billing and collections. Let's talk about who's going to be responsible for the payments of the services. Remember, that can be a shared task from the insurance company and the patient, or if there is no coverage by the insurance, the patient has to pay for it, or if you don't have anything to pay, the insurance is going to cover everything. So that's basically what it is. Okay. So things that we should focus when we are talking about the patient billing and collections are we're gonna follow some steps. We're gonna monitor the payer adjudication. Remember, adjudication means it goes to the insurer meaning the person or the company, the insurance company, where the patient is affiliated with. So basically, that's what it is. And we're going to find out how we're going to do that. So remember the process of the billing of the process of the claim that we talk about certain steps that we have to follow. So that's basically what it is. After, these claims have been adjudicated to the patient's insurance company, then we're going to know exactly how much money the insurance is going to pay and how much money we are going to bill the patient if that's the case. All depends what type of insurance they have, whether it's a private employer sponsor or whether it is government paid. So basically that's how it is. Then we're gonna go, well, the billing department is gonna generate a patient's statement. Remember, explanation of benefits or the bill that they're gonna be sending to them. So we will talk about that. We're gonna follow up payments and collections. So if the insurance have to pay us, we have to, check the status, follow through. The same with the patient. If the insurance doesn't pay the whole amount for the services, we bill the patient for the balance. And we have to keep and track what's going on. So that's what we are going to do. Okay, so just make sure that we kind of understanding all the steps that this billing process follows. And then collections. Remember, billing is charging the patient or the insurance company for the services provided. Collection is when some money has not been paid, some money is owed to the office, some accounts receivable, then we have to bill the statement to the patient. So that's basically what it is. So there are some objectives that we're gonna be covering today. What is it that we're gonna learn during this chapter? We're gonna explain the structure of a typical financial policy, meaning how do we go about collections? Because we talk about already about the process of the claim, but then we're gonna see what we're gonna do with, how do we collect the money? Because that is our financials for our organization. So we need to collect that money. That money belongs to the office. Classifies the responsibilities for each position that are typically part of billing and collections. We talk about that. We're going to see if this is the job of the insurance company to pay for the services, or it is the responsibility of the patient, or both. So that's basically what it is. Remember, we only send collections to our patients if that was money that it was owed to us. If the insurance covers everything, or the negotiations that we have with the insurance is just to accept assignment as it is, well, we don't have to bill the patient. So all that's part of what we just described right here. Describe the process and methods used to collect outstanding balances. Well, think about this. If the insurance did not cover everything, then for the services, then the patient is going to be responsible, and so on and so forth. Discuss the tools that can be used to locate unresponsive or missing patients. What requirements we need or what steps we're going to follow if we try to locate the patient. Remember that sometimes the patient don't respond to our collection letters for any reason, so we have different ways to contact the patient. So remember, we can call them over the phone, we can reach them through the patient's portal, or we can send them a mail to their addresses. There are many other forms, or we can contact, the emergency contact just in case. Who knows what will happen to the patient? That's why, remember, we have to update the patient's information every single time the patient comes to the office for services. Because if the patient changes the phone number, we're not going to be able to reach them. Not only for collections, but for follow-up appointments, for blood results or laboratory results. Any issue that might arise during the process of, this patient-doctor relationship, anything can happen. So we need to have the patient's information up to date, just in case we need to contact them. So that is basically what it's talking about. Describe the procedures for clearing uncollectible balance. Analyze the purpose of retention schedule. So once again, what it is permitted by a law, because remember, we have to follow law and regulations, how we can collect. When do we send these patients to collections? So what is considered, a delinquent unpaid bill versus something that it is late, past due, or overdue. So we have different classifications. And of course, we're going to talk about, I'm going to remind you that these documents for billing purposes, we're supposed to retain them for a certain period of time, according to HIPAA regulations, remember. So that's basically how, what we're going to cover during this chapter. So let's get started. So patients, billing, and collections. The last step in billing and reimbursement processes include the following tasks. Every single process that goes along in the medical office or hospitals, they follow certain steps, certain policies. And patients are required, certain things to do, or the insurance. So we have to provide them with all the information that we need before we render services. Remember, during the registration time, we have to tell the patient. We have to let them know in advance whether, who's going to be responsible for the payments. That's very important. That's how everything starts. This is the billing and collection cycle. From the moment that the patient sign up with us to see the medical provider, now you have a responsibility, which is paid for the services rendered. But we have to explain the patient. We have to let the patient know, because when it comes to money, again, I cannot stress enough that when we talk about money, you don't want to reimburse money, particularly when you have an insurance, because you assume that the insurance is going to pay everything, or at least you pretend that that's what you understood. So we're going to make sure that we clarify that. So remember, we're going to tell the patient, because that's how it works. If you do not have insurance, you're responsible for the bill. If you have insurance and the insurance does not cover the services provided, you're going to be responsible for the balance, period. If the services are not covered by your insurance, but you still want those services to be provided, you're going to be responsible for those services. So you're going to be responsible for the fees, for the payment. So that's what this is so important, because we don't want to end up, after rendering the services, collecting the money from the patients, sending them letters, then sending them to collections on, agencies to get the money, because that means money that we don't have. And that means trouble. That means we have to pay collection. agency a percentage of whatever we're going to collect if we collect that money. So we don't want to go through all this trouble. So for that reason, we have to let the patients know at the beginning. We have to let them know, we have to ask always what type of insurances they have, if they have 1, 2, 3 insurances. So we have to have all of them in file. So that's how it works. Because if they have a secondary insurance, they have a second insurance, and we don't ask, maybe the patient is not going to mention it. If they don't mention it, then we're going to bill the patient for the balance. The patient is going to come to the office. The patient is going to be very upset. And then it's going to say, no, my insurance always pay. I never have to pay anything. And then you have to go through all these, situations in order for you to clarify later on that the patient has a second insurance, and we have to bill that. That creates issues with the patient and delays with the payment, because now it's going to be a delay to, to file for that claim to the other insurance company. And probably the time has run out. Remember that we have 30 days in order for us to submit those claims for services provided, but we spend so much time trying to deal with the patient and see if the patient pays until we finally, find out that, the patient has a second insurance. So we have to prevent that. Remember, I going over this because if you work for a doctor's office, this is what you have to do. Believe me, 60% of the students goes to doctor's offices. That's what they start working. So that's basically what it is. So when we talk about billing, we're talking about how much the patient owes to the office, how much the insurance is reimbursing the medical provider. So that's basically what it is. Because depending on how much the insurance reimburse the medical doctor, we're going to see what the balances are. Any balance, remember, we have to adjudicate this to the patient. So we're going to bill the patient, because the patient is responsible for it. And when that happens, if we have to bill the patient for the balance or for services that were not covered by the insurance previously discussed with the patient and the patient accepted, then that's how we're going to do. We're going to send them a statement to show balances, meaning money that they owe the office or they owe to the office. Then we're going to post those patient's payments. So when the patient pays, someone in the billing department is going to record that and the accounts receivable. So we kind of balance that out. So that's how it works. It's like anything else. It's like when you pay your bills, your electrical bills, your gas bills, your internet, whatever bills you pay. When you pay them, when you don't have balances, because if you have a balance, you're going to receive a bill that you didn't pay the full amount. So that's basically what it is. Here we deal with insurances, so we have to wait until the insurance bills the patient or reimburse us. And then whatever balance is there, whatever the insurance did not cover, then we're going to bill it to the patient. So that's how it is. So we're going to keep on continuously, interacting with the insurance, with the patient, and documenting every single piece of information that we receive, including the letters collection. We will talk about that a little later on. Another job during billing and collections is we're going to examine these aging reports for patients' accounts. When we talk about aging reports, it's for how long these bill or the money that the patient owes us is being unpaid because everything has a transition time, some timelines for these patients to pay those bills before it goes to collection agencies. Remember, we collect first, the office. The medical doctor instructs the billing department from the office or the medical assistant to send letters to the patient, reminding them of balances, money owed to the office. And if we do not get any response or we don't get paid with certain period of time, then we are going to surrender these collections to a collection agency. That's how it works. Now, if we pass these delinquent accounts to a collection agency, we no longer have any collections responsibility with the patient. This is being passed to professionals. So a collection agency is going to charge a percentage of whatever money they're going to collect. It's not that we're going to pay them a salary. No. If it is $100 that the patient owes us, they give the agency 10%. Said, okay, you're going to get 10% of that. So they're going to get $10. If you collect that, you're going to get $10. That's how the collection agency works. That's what the collection agencies start kind of harassing you, so to speak, to collect the money because that's their job and that's how they get compensated. If they do not get this money, then they don't get compensated. That is it. That's how it works. So we will talk about that a little further up on this chapter. Financial policies. There's always policies in your organization. Each organization has, different policies of how to collect, how to bill, and how to collect money. Not every single organization have the same identical, steps or processes, except for the billing to the insurance company. That is the same for every single billing company. And the codification, those are the same. But the cycle, meaning how do we, send the collection letters to our patients that owe us money, is different. So that's basically what it is. The process for the claims to the insurance company, they are the same. They are standardized for every single insurance company. But how do we collect the money from our patients are a little different. So that's basically what it is. So medical practices uses many methods to inform patients of the financial policies and procedures. So remember, from the first time that the patient joins our office, we already start telling them about, money that the insurance do not cover for their services. We tell them about the copayments, about the coinsurance, about deductibles. Once again, that's not going to be you, it's going to be the billing department. But we're going to tell them just in general that they need to be aware of this. Because when they sign up for these insurances, they've been told that is the time that someone from, that particular company where you work at, they're going to explain you about your insurance. What are the benefits? What's the plan? What services you're going to receive? What services are not covered? Of course, you're not going to find out what services are not covered until you are facing that situation. But they're going to tell you in general, there are some services that your insurance will not cover. For that reason, if they don't cover it, you have to pay it if you receive the services. This is how much you're going to have to pay per year. This is the premium for your insurance. If you got it, self-insurance, they can explain you everything. But if you got it through your job, they can explain you that too. And you have to file, to sign and complete certain documents. This is not like automatically in your job, you're gonna get health insurance. No, if it is available, they're gonna offer it to you. And if you want to change the plan, depending of, whether you are just insuring yourself or it is a family plan, it changes. So you need to know. Because the more family members that are, insured or covered by this particular policy, the more money is going to be. The premium is going to be more. Remember, the premium is the total amount of money that we or the insurance or the employer pays for our health insurance. That's basically what it is. But then we have to take in consideration co-payments, deductibles, and co-insurance. These are the patient's responsibility. So that's how it works. So we got to make sure that the patient understands that. The patient is not going to understand what is co-insurance, what is deductible. We have to talk to them in plain English. So you can say, okay, you're going to get this plan. So for this plan, your insurance is going to pay this much, but you're going to pay this much. So that's basically what it is. If you have more services in your plan, then the premium increases, your deductibles increases, your co-insurance increases. That's it. Your co-payments do not increase because it doesn't matter what policy you have. Depends on the services that you're going to receive. Your co-payment is going to be the same, regardless whether you have a premium or $10,000, $8,000, $2,000. The co-payments are going to be the same. It is the deductibles and the co-insurance, the ones that are going to factor out how much you're going to pay out of your pocket, or whether you're going to consider having second insurance so it can pay for the balance. All depends, but that's how it works in this financial arena. So you're going to pay financial arrangements for unpaid balances. We're going to talk about more detail how we can kind of, negotiate with the patient because we need the money to come into our office. So even though if it's going to be in installments, we're going to have a plan for them to pay us back. But remember, it can be paid with credit card, debit card, check, money order, cash. It doesn't matter. We just need the money to come to our office. So that's basically what it is. Payment for services not covered. Once again, this should be explained at the beginning of any procedure. Every single time that the patient has to go for a procedure. I'm talking about procedures means, something that is costly. A surgical procedure. A procedure that, demands more money for the services. So usually for these procedures, the insurance sometimes don't want to pay. So if you decide to go for those services, then you gotta pay for it. So before we send you to do this particular procedure, we're gonna talk to you, the patient, and we're gonna explain what the conditions you have and what is these procedures necessary to be done. And if the insurance do not cover, we have to explain you the reason why the insurance is not covering those and the options that the patient have, which is, you know, paying from their own pocket if they want those services. So that's basically what it is. We have to be upfront with our patients. Remember, collecting that money is going to be very, very difficult and time consuming. Day of services and discounts. Well, all depends of what the policies that the patient has. Sometimes they do some type of, write-off. For some people, they do some professional courtesy, like me, if I go to the hospital. When I was in active duty, I got a professional discount. It's a professional courtesy, it's called. And my family too, my kids, they can go there and I get certain discount for certain services. So that's basically what it is. So all depends on what plan you have and what is your profession or certain conditions, certain age-related situations. Once again, it says acceptance of various forms of payment because your office has to be, agreeing with what type of payments you're going to have before we actually render those services. That's what we interview the patient to begin with. So most of the patients, they have some type of health insurance. Very few people pays cash for the services. When I'm talking about cash, means using debit cards, credit cards, money order, checks, all that comes down to cash payments, meaning you don't have an insurance company that pays for those services. There are penalties if you submit or you pay us with a check or credit card or debit card, whatever it is, the case may be, and you have no funds. It's like anything else. You purchase something and you have no funds, then, you're going to get a penalty for that. So that's basically what it is. We're going to charge you more for certain, type of payments that you may do, particularly when you don't have enough funds to cover for those services. So that's how it works. And every single medical facility has their own policies. Once again, wherever you're going to start working, you got to find out what policies they have. You can't just say yes to everything. I remember when I was working in one of my friend's office, they didn't accept credit cards. Or whether you pay with cash or check. No credit cards. So that's how they work. So you have to be familiar with the type of payments that your office receives. Cash is always welcome, but when it comes to debit card, credit cards, it's a different issue. And make sure that you know that, whether they take checks or not. I know some people that do not take no checks. They might not have no funds. You just write down a paper, you sign a paper and endorse that check to the office, but then no funds. What are you going to do? Start collections. And that is a troublesome situation. So we got to make sure that we learn exactly which policies our office follows. It varies from institution to institution. So learn the ones, the policies that you are using in your own facility at that particular time. They are not the same. Yes, there are policies for collections, but they do it in different ways. So you have to be very careful. Working with patient statements. So again, this has to do with the medical provider, okay? Who is your primary care physician? Because they are the one who's going to receive a statement from the insurance company. Remember, I put it right here. It's very important. I'm going to go over this later on a little more just to make sure that you get this. Remember that the providers or the hospital receives a statement from the insurance that is called the remittance advice. And in this document or this statement, what it's telling us is giving us a detailed information about services provided, whether they pay what the medical doctor was requesting for, or how much actually we got paid for those services. The codes for those services. So we have to balance it out, because when we send the bill, when we send this claim to the insurance company, we already charge depending of how, the rates of this particular provider. Sometimes we don't get paid the whole thing. Sometimes we got, things that are rejected or denied. So this is what we pay you. This we didn't pay you for this reason. So now you have to figure it out before you send the statement to the patient. Because without this remittance advice statement, we don't know exactly how much we got paid. Think about you receive your pay stub from your job. And it says there, oh, you're getting this much. And then you said, oh, I think that this check is kind of short. I'm not getting the money. Something is going on. Oh, read more details. It says right there, hours work. How many hours do you work from this day to this day? And if there were holidays, if you did overtime or not. So that's, an itemized kind of remittance advice from your employer, from the human resources or payroll, explaining you what is it that you are being paid for. Well, the same goes for the medical providers. They receive this remittance advice. It's not called the paid staff, because that's for payroll. And it's going to be an itemized, detailed explanation of services that I submitted and I got paid based on my charges, whether they pay me what I was requesting for or less. Which ones were paid, which ones wasn't. So based on that, I know already how much money I'm going to bill the patient for. Because now I know how much I received from the provider, so whatever else that I was expecting to get from the insurance and I didn't get goes to the patient. So the less money that I receive from the insurance as a reimbursement, the more money that I'm going to be billing the patient for. So that's basically what it is. So you're going to make your own adjustments. You're going to be balancing out, and whatever balance you have, again, you're going to be sending to the patient. We are not going to tell the patient every single time, oh, well, you owe the coinsurance, the deductibles, the copayment. No, because that was explained to you to begin with. But if the patient doesn't understand, we just tell them that's the balance. That's what the insurance company did not pay for their services after they been explained about the procedure, about the cost of those services, and what happened if the insurance doesn't cover all that. So that's how you have to be. Remember, you have to be clear up front with the patients, no surprises. And you have to explain them in the language that the patient speaks, using layman terms. You're not going to be telling them, oh, well, your coinsurance, your deductible. They don't know what is that. They don't know at all. They don't understand these terms. They didn't take billing and coding. Someone that has not taken this class, they don't have no idea what coinsurance is. Oh, coinsurance sounds like an insurance thing, right? If I never pay co-payments in something, how am I going to know about the word co-payment? Who knows about remittance advice until now? If you didn't deal with this insurance, the health insurance, you're not going to understand any of these terms. Even though after I explain it to you, still it's a little hard to remember these terms. Not only to remember the terms, but what is it that they entail? What is the purpose of these terms? What they mean? It's not easy. If that's not easy for us that we're learning, what do we expect from our patients? So for that reason, we have to be a little more cautious when we talk to them, explaining them. Well, Mr. and Mrs. Smith, this balance is because the insurance did not cover all the services that you received last time. And you don't have to explain much because you have to tell them you receive an explanation of benefits. You have a letter that the insurance sends you. Because it's not us. The insurance sends the medical provider a remittance advice about, services that they are reimbursing the medical doctor for. But they, at the same time, they generate another document that is not called remittance advice, it's called explanation of benefits that is being sent to the patient. So the patient has to read it, evaluate it, and make sure that they know that all those services were provided. And because they receive all those services and we didn't get paid for all those services, you, patient, are responsible for it. So that is another reason why patients receive this explanation of benefits. This explanation of benefits was not sent to the patients, has not been sent to the patients all the time. This is not new, but it has more likely the time than Medicaid, when we have plain Medicaid, became now an HMO. So that's basically what is important to understand, the policies and the cycle of billing and collections, how it works, because we need this money. So that's basically what it is. So we have to be very clear with our clients. Even though if we explain all of that, when the patient receives the bill, they're not going to be happy, but they are conscious about it. If you have explained them how it works, what is suspect after they receive the services, they're not going to like the bill, but they're going to understand. And they have to make their effort to pay. So the patient statements are designed to be direct and easy to read, clearly stating. So what should be in that particular statement? General information about the practice, What type of practice do we have? Because remember, when the patient signs up for our office to receive services from them, they need to know who we are. What is it that we do? What specialty our medical providers are offering here to the patients? So that's basically what it is. So in general, this is a family practice medical doctor. This is a pediatrician. This is the gynecology or GYN medical. This is the cardiologist. When they're going to go there, they need to know. Remember, the patients do not know every single specialty. They're just having some issues on medical conditions, and they just go whenever they feel like somebody is going to be assisting them, helping them. But we need to provide all the information to them so they understand what is the problem that they have and who's going to be helping them. Once again, we have to explain them, we have to break down, we have to give them more details. What services are going to be provided to this patient? What services you're going to receive? That's what we talk to them. When the patient, when the medical doctor evaluates them, when you go there with a complaint, you're having this type of problem, that is just for them to be examined, remember. But then if there is any procedure needs to be done, now we have to explain that. This procedure is for this procedure is for this, and so on and so forth. We don't just order things for the patient. We have to explain then what's the nature or the condition. And due to that condition, we need to order this particular test. We need to order this particular medication. We need to refer you to this particular specialty. So that's basically what it is. But then we have to take in consideration which type of insurance you have. Whether your insurance can cover or not those services. Remember, we're talking about billing. And when we talk about billing finances, we are definitely talking about money. We need to explain. See, explanation of costs covered by the payer. Now, remember, the payer can be the patient, can be their workplace, their employment, or their insurance company that they're using. Either of those is going to be the payer. Remember, the payer is the one who pays for the services. To who? To the insurance. And if you don't have an insurance coverage, then you pay directly to the medical provider. There is no insurance involved. But we always have to tell them, particularly when, the procedures are costly. So remember, an X-ray, CAT scan, MRI, those are very expensive procedures. Particularly CAT scans and MRIs, sonograms, X-rays. They're a little cheaper, but they are a lot of money. And sometimes, your insurance might not cover for those. Your insurance might give the provider advice to do other testing instead. So if there is a need, well, the medical doctor needs to provide all the documentation. But sometimes even with the documentation, the insurance sometimes do not pay for those services. If the insurance do not pay for those services, now we're going to have these balances charged to the patient. That's how it works. Besides the explanation of each of these procedures order, in the cost of them, we have to document when these procedures were done. And when do we expect this money to be received? Because we have certain scheduled times for money to be paid by the insurance and money to be paid by the patient. Remember, we don't just send them a bill charging for, services provide or balances, and we don't just leave it open. Whenever you feel like, you want to pay us, just stop by our office. We don't do that. They have certain limitations. Because remember, these accounts can move from past accounts, past due accounts, overdue accounts, and delinquent accounts. So that's basically what it is. And remember, this is going up because you're charging interests, penalties for non-payment, not interests that will be paid, late fees. You always have to discuss with the patient the different, options they have to make the payment. That's what your office had to have, different options for payment. Because you might not have the cash at a particular moment, but you might have a credit card. So, or you can pay in small amounts every 2 weeks, every month. That's something that you have to negotiate with the office, with the hospital, with the billing department. And you have to be familiar with this system medical assistant because you are going to have these patients, particularly in the doctor's office, because they don't have a billing department right there. Remember, medical office, medical doctors, small clinics, small businesses, let's put it that way, they contract with an independent billing department. So usually it's not within the facility, it's somewhere else. They're doing it from home, they do it from somewhere else. So you're not gonna have someone from billing department directly, addressing the patient's concern with the patient arising to our office, complaining about something, particularly billing. So then we have to be familiar to make sure that, whether we have the right answer or we can direct them to the appropriate department so they can, answer the questions. So get familiar. Ask the people that is working over there. Someone comes here complaining about billing. What do we do? What is it that I do? Do we have a billing department here? No. There is a number right here that you can give it to them so they can call billing department. Okay. They might not be willing to give the number, so get familiar how your office works. Remember, you have to follow your office policies. It's not something that you're gonna make up.
Like you're being mean towards me, like I just said this.
So that is how it works. So you have to be very careful how to address these issues with the patient when it comes to money. Remember, these are our clients, and we want to keep these clients, particularly the clients that are being with us for a long time. We're going to make the right decision. We're going to be able to communicate very respectful with these people. That's basically how it is. And let them deal with the billing department. You're just answering some simple questions over there. So that's basically what it is. Remember, if we don't know an answer, do not just make up something or don't dismiss the patient telling them, oh, well, I don't know. You probably have a number. I have no idea where you contact. We don't have the billing department here. That's not the right answer for the patients. Remember, they are our clients. They are the one who, bringing the money to the office. And things happen sometimes with billing. So you got to make sure, that you handle this in a very professional, sensitive matter, because that's how it works. Cycle billing. Now we're talking about here how these accounts that has not been paid or balances that needs to be sent to the patients. It can be done weekly, bi-weekly, or monthly. The sooner that we bill the patients, the sooner that probably we're going to get the money. So that's basically what it is. So those balances owed by the patient needs to be sent those letters, whether computer generated or paper generated, it doesn't matter. You can send them directly to the patient. So that's how work. So they give you an example right there that, if the billing cycle is done weekly, then the patient's accounts are going to be divided in 4 groups because each week, see, a month has 4 weeks. So that will be, each week is 25%. So if we're doing billing every week, we're going to send an amount of more likely 25%. Because we're not going to wait until it's a month because it's going to be too many patients accumulated for a period of 30 days. But then we might going to be running out of the grace period that we have to send these letters. Because remember, it depends what you're sending it, the faster that you send it, because the patients are not living next door. So we have to send them as soon as we get, the remittance advice, we should get these balances out as soon as possible and start billing the patient because we need to start collecting those balances all to the office. So that's basically what it is. You're not gonna wait. This is not the cycle billing for the insurance company. This is not completing the claims for the insurance and waiting for reimbursement. No, we have already received the reimbursement. But there are some balances within those remittance advice notices that we need to collect from the patients. So we wait already some time to get reimbursed from the insurance. Now the second part is get the money from the patient. And we're going to get it as soon as possible. Because the patients already received the services. Remember, we do not bill for services ahead of time. Oh, the patient is going to have some procedures done this particular day, so we're going to bill them before that procedure is done. No. We bill at the time of the service, after the service is being provided, not before. And with a window period of 30 days. If you don't do it within 30 days, then, the insurance is not going to pay you. But for the patients, is immediately we receive the reimbursement from the insurance. Now we know what is the balance. Now we're going to send it to our patients. So the billing department do not wait for a week. They just send every single day sending billing. As soon as they get in it, they immediately say the balance to the patients. So that is the right way to do it. Here is just an explanation because this was done when it used to be done using the mail. because you're not going to send a mail individual one when you have a bunch of patients who own. So you just generate them and, wait until, you accumulate a certain amount and then you send it to them. Because now we use, digital information that can be done daily. Each patient is going to receive this. But that's how it was planned for Parayo. So again, the way that they are going to, build the patient varies, depends of, offices, what policies they have. But we want the money right away. So think about it. They're not going to wait for a week to bill you for the balance. As soon as I receive the balance or the remittance advice, I know that you own this much money. Immediately I'm sending it to you. I'm going to be generate those bills. That's how it should work. Warrantor billing. Now, what is the warrantor billing? This is a billing system. This is a billing, a digital. As I was mentioning before, back in the days, we didn't have any of these, electronic systems. So everything has to be done manually. Now we do it, through directly through the system. And what is the advantage of using electronic systems for billing? Just like the advantage for medical records, electronic medical records, or electronic health records. The time that we spend in processing these letters, these statements to the patient are going to be faster. So the time that you're going to be sending them. Can you imagine typing this letter in a typewriter or writing it down in paper? That's time consuming. Now we even say paper. We don't have to use paper anymore because now everything goes electronically. I receive my statements electronically. And if I need to ask anything, I just go online and I send information through, these applications. That's it. So I don't have to be running with letters and things like that. I don't recall the last time that I went to the post office to send something by mail. It's been a long time because most of the things that I do it electronically. So that's basically how it is. It's a lot easier, convenient, time saving, and it's faster. The service is a lot faster. So that's basically how it works. So it's not just, for the department that is processing these letters for, collecting balances from services provided, but it's for everyone. These accounts receivables needs to be, kept up to date. The practice do not function without money, without the financial department. Any business that goes out of businesses because financial problems. They don't close the door because they are doing really good. No, you close your business when business are not going well. When you don't have money to pay for the rent, for the utilities, for the employees, then you have to close your business. Now, the longer that we take to receive the money, well, see, we are running out of funds. So that's not good. So it says where improves patient satisfaction will reduce phone calls to the patient for sending follow-up letters and statements. That is true because when we do everything electronically, I just filed some papers for some stuff. The same day, I just filed in and I got the answer. Okay, we received that. It's in the process of evaluating them. A couple hours later, I received another email. Oh, your application has been approved. You will get this in the mail again. You know, I'm talking about my email. So that was super fast. But can you imagine if I have to do this, sending it by mail? Just the process of typing the letter, printing the letter, and putting it in an envelope, go to the post office, sending it out, and waiting for them to receive it, waiting for them to read it, waiting for them to evaluate it and to make a decision, and then send me a decision by mail again. That's gonna take a lot of time. So that is how it used to be. See, medical doctors, if they were lucky, they will get paid within 2 months, 60 days after sending, the bill or the claims to the insurance company. It took 3 months, 4 months to get the reimbursement. Now they can get it in days. Few days and you have all these reimbursement done back to you. Well, the same goes with the patient. You know how long it takes also to make phone calls to the patient to remind them, to contact them. Sometimes you don't reach them. So, or sending them letters. It takes a long time, believe me. Whereas if you use the electronic system, it's going to be a lot faster. And it's convenient for all of us. So that's basically how it works. Having this billing system, believe me, is time saver, money saver, headache saver. Organizing for effective collection. So what is it that we have to do to get this money back into our accounts receivable? What are the steps? What are the procedures? What type of activities related to the patient account we should follow? So that's basically what it is. So once again, large practices, if you have, work for a hospital, well, they might have their own department of billing and coding. Because remember, as I mentioned before, they can afford it to have someone within the hospital. Hospitals do have billing department. They don't contract with a, outside contractor, with an external contractor. No, they have their own billing and coding personnel. So the hospital pays them to the employees who do that job versus contracting with an independent company. So that's basically what it is. Think about the laboratory in your doctor's office. When you get your blood drawn, your urine collected, any other type of body fluids, that's not a lab. That's just a room right there where you just collect, but it's not processed there. It's not analyzed. You have to send it to an external laboratory. Well, doctors' offices do not have the space, do not have all the money, do not have all the equipment, do not have all the trained personnel to analyze that blood. So you pay an external company. That's what we do with billing. Because these small businesses cannot afford all that. So we send it to an external company. They do the job. So that's basically how everything works. So billing department has the billing collection part within that department. And they are responsible for establishing what policies they're going to follow for the collections. Who's in charge of doing these letters sent to the patient with the balances? Who calls them? Who follows up? That's basically how it works. So each department has their own personnel who's going to be in charge of certain functions. See, in your department, you're going to be the medical assistant. You're going to have some functions there that are very particular to medical assistants. Well, the billing department is going to have some functions very particular to what they do, what functions they perform. And it is to bill the insurance company and the patient and receive the money from both. And then enter that information in the patient's billing files and balance it out to see whether they have paid money in full or they have anything pending. So that's how it works. So anyone in this department is going to have certain responsibilities. We're not going to call them names. We're not going to say this is the account representative, this is the billing and collections manager. We're not interested on that. We're going to have certain people that is going to do certain, they're going to have certain responsibilities within every single department. See, in your office, you're going to have an office manager, a nurse, a supervisor, a medical doctor. So that's basically what it is. There are going to be some people over there that are going to be in charge of certain functions from certain staff members. That's what billing department does. They're going to have certain people that are in charge of center services, and that's exactly what they're going to do, because the major purpose of this is to get the money to the office for those services provided, whether it's from the insurance company or from the patient. So that's how it works. Says right there, collections specialist, staff member with training in proper collection techniques. Of course, every single individual that works in any particular department has to be trained to do just that within that department. Since you're going to be trained to be a medical assistant, that's exactly what you're going to be doing. You're not going to be the billing encoder, no, because you weren't trained to do so. We're not going to send someone to just call for collections if you're not being trained to do so, because you have to be very, very sensitive, particularly when you call to, request for money that is owed to the office. So remember, patients or whoever owes the money, they don't want to pay. Do you think that I, enjoy paying when I get those bills from my services? I wish I didn't get them, but we have to pay them because we received services. It doesn't matter what services are. If I receive my internet services, I need my internet services. Otherwise, I couldn't be working with you right now. I need my electrical bill. Without electricity, I cannot use my internet either. What are we going to do? I need water. I need gas. I have to pay those. So again, If I'm going to take public transportation, I need to compensate them for that. I need to pay those fares. Everything is, you receive a services, you get paid. You get a services, you have to pay. So that's how it works. Very simple. Sometimes we do not understand that. We know that we have to pay this phone bill, yes, but when it comes to our health, then we see it as something different. No, our health is the most important thing. So sometimes that's what I explain my patients. I said, I understand that we all go through tough times, right? We have to pay, but you have to pay your rent, right? Wherever you live. You have to pay your, your utility bills, don't you? Well, now we're doing maintenance of your health, so isn't it fair to pay for it? So that's basically how it works. So you have to be, realistic. If I'm getting some services, I gotta pay for it. That's why you come into the school, don't you? Are you gonna get a job and gonna work for free? No, you're gonna be compensated. Well, if we receive services from the medical providers, don't we have to compensate them for the services? It's the same. It is the same. We just see things differently. The collection specialist, remember, this person really needs to be well trained because it's going to be working with patients that owe money to the office. And sometimes it's not that they don't want to pay. Sometimes it's that they can't afford to pay. How are you going to go about that? You have to have a lot of patience, being very convincing without, jeopardizing, the image of the institution that they are representing. Because there are some regulations for collections. You can't just call me at any time and, tell me, hey, you owe me some money, and if you don't pay, we're going to take you to court. That doesn't work. That works in my country, not here. Here we have certain regulations. There are some laws that protects people from, being harassed from these collection agencies or even the office. You're not allowed to call someone and tell them, to threaten them. Hey, if you don't pay, don't even show up here again because the doctor's not going to treat you. That's called assault. See, we can talk about assault all the time because we're being assaulted all the time. Being rude with someone, you're not going to get anything from them. So you have to be really, really trained in how to handle these particular situations. You have to be familiar with all these reports that is called aging reports. Because remember, after they pass the 30 days, they change name, pass 60 days, they have a different name. And if they pass 3 months, they have a different name. So all these past due, accounts, they're going to receive a name depending of how, how far they are from the moment that they were billed from the first time. So that's basically what it is. And remember that we need to know because we need to know when to remove these accounts from our office and give it to a collection agency. So that's basically what it is. You have to be very professional. You have to use every single, ethical and professional demeanor when you're talking to these patients. In general, any person who collects doesn't need to be from, for insurance purposes or for the health department. No, for anything. They have to have certain demeanor how they gonna go about managing these calls or these letters that you send to the patient. Because these letters have to be very professional. You're not gonna get anything by insulting the patient, and besides, that can be used against you. Because you're threatening the patients, and you're not supposed to do that. So they can use it against you. Later on, we're going to talk about, certain things that you should not say, should not do, should not call at these particular times, these particular days, because that is prohibited by law. So we need to be familiar with all that. Things that we consider, because we talk about this, we talk about fraud, avoiding opportunities for fraud, embezzlement. This term, probably some of you never heard about it. I've seen it many times. But what this means is, you are a thief. You are committing fraud. This is someone who has been given the opportunity to work and manage money, manage finances, but you take them with you. So you steal it, you misuse it. So that's basically what it is. So that's not good, because we entrusted you this job in which you have to collect money, but the money is not for you, it's not for me, this is not for us. This is not for the billing department. This money belongs to the organization that they are representing or the organization that they're working for. So that's basically what it is. So that money has to be collected and sent immediately to the financial department of the particular company where you're working on. So that's basically what it is. Now, to avoid this, usually we have different people dealing with this money that you receive, with this collection money. It is not just one person in charge of that. No, there are different people and different people monitoring how this money is used after they receive it. Where is this money goes? Because that's the most important thing in finances. What is the purpose of you collecting the money from the patient, but that money didn't go to the office or to the financial department? This money got lost in translation somewhere else. Someone else took the money. Not good, right? So once again, we're always going to have different people in the financial department in charge of these accounts receivable and accounts payable, because it happens in either of these accounts, because these individuals have access to the money, whether paying for services or supplies or maintenance or whatever the case may be, or receiving money from, other organizations, patients, companies, whatever the case may be. So that's basically what it is. So one person is not going to be in charge of doing the entire process of the collections. See, you have someone who calls requesting for the payment. You're gonna have someone else who's gonna be receiving the payment. You're gonna have someone else who's gonna be entering this money into, the accounts receivable. It's gonna be another person who's gonna be checking and balancing these accounts receivable and payable all the time. So it's not the same person who calls, it's not the same person who receives the money, not the person who enters this into the account receivables or payable. No, it's going to be different people dealing with that. So each one is going to be responsible for whatever part of the responsibility was. If you are the one who received the money, we need to know where the money went because the other person didn't receive it. So didn't deposit it. So what happened? So that is something that we definitely need to take in consideration. For those monies that we receive and it's cash and it doesn't go directly to the account, so then it has to be deposited daily. See, whenever you're working in an office and you are in charge of receiving co-payments or any other services that they have to pay you cash or with debit or credit card. Well, for those, you have to have the receipt. So you can, adjust the account. You can balance it out. But if it is cash, all that money is going to go to the bank. If it is checks, all that at the end of the day, someone is going to be responsible to take this money and deposit that money in, the company's account, whatever account they have decided. So that's how it works. This is not the money that we're going to take home or we're going to deposit it in our personal accounts. So that is basically how it works. And then we're going to bring all the receipts from the bank stating what money was deposited, which day, at which time, in which account. So we're going to show proofs and keep those receipts or statements on file. Remember then, we're going to take these encounter tickets and we're going to total them. And then we're going to post these payments, whether it's an account receivable or accounts payable. And then we're going to get a balance. Then we know exactly how much money we receive, how much money still is spending, or if the account has been paid in full. That's how it works. So it's very interesting. And we have to do our job. And it's our responsibility. We're receiving a salary for it. So I don't know if I mentioned before, but when I was, I wasn't actually working with my friends, but I, whenever I have day off, I went to his office and I work, he paid me, but I wasn't his employee. I just want to help him and I learn a lot. We have to fire, medical assistants because they were stealing the money, the copayment money. They were using the copayment money to buy lunch, breakfast, to buy stuff for themselves while they were at work. That money is not for that. Or the petty cash. This money that we have in, our bags every day. And that money is just to use for very small things that needs to be purchased just in case. But it's not for us to buy lunch, breakfast, dinner, or any other things. That's not for us. Not to buy, the Metro car. No, that's money that belongs to the office. So this person was stealing the money from the co-payments. You can't do that because, you're going to get caught. That is so simple to get caught for those. You might think that they don't know. No, they're just waiting for you to get a little more greedy, to have a reason to fire you. So that's basically what it is. And remember, they let you do it. They know that you're doing it. They're just letting you do it. So when you kind of get to a certain point, then it says, okay, that is reason enough to fire this person. And if they're going to go and collect money, they're not going to be able to do so. So you will lose. So be careful because the temptation is there. I've seen it. We have in an office that we have a lot of people who were paying cash. They were paying $150 per visit. And we have like 10 or 12 people daily. They didn't have health insurance, so they pay cash. So all this money was collected by them. But one of the things that people do not realize is that, every single patient has a medical record. Every single patient has an encounter form. And in that encounter form that we're not going to send it to the insurance company because the patient pay cash, because it says right there, okay, what is the method of payment? Self, cash. So we know that we have that encounter form. It is there in the medical records. So immediately after the end of the shift for that particular day, we're going to get all these medical records that they were cash, and we're going to balance it out with the money. And if the money is not there, where did the money go? So that's how it works. Copayments is the same. How many people pay copayment? Receipt has to be given to the patient. And the original to the patient, the copy goes to the medical files or to the insurance files, financial files. We're going to balance it out at the end of the day. And if you didn't give the patient receipt, no problem. You cannot fool us. You still have other ways of finding out because we have the patient medical records. You cannot get rid of the patient medical records. So it's very tempting, right, to grasp some money from there. But no, it's better stay away from all that because I'm telling you, they let you do it. They know that you're doing it, but they allow you to do. And when they see that you have done enough, now we have enough proof to get rid of you and not to give you an employment. Who loses for a couple of dollars? You don't want to do that. But there are some people that do it. So if you see someone doing that, don't get involved. Don't get involved. Somebody's watching them. So you just stay away from them. That's all. Don't go out with them to eat lunch because then if they pay for your lunch, you're an accomplice. So you will pay for it, even though if you didn't do it. So again, just stay away from them. Don't say anything. Sooner or later, they're going to be caught. So that's my advice to you. So stay away from that part of the financial. Whenever you receive copayments for the patient, cause the copayments most of the time are cash because there's a small amount of money. So just receive it, give them a receipt, and keep a copy in the files with the money. And later on, at the end of the day, they're going to balance it out. And every single receipt, every single copayment has to be posted. So that's basically how it works. So be careful with that. Money is very, very tempting. So collection regulations and procedures. Remember, you can ask me questions at any time. I'm just giving you hints of things that happens in the office. So, make sure that, you're aware of all this. And remember, do not sign anything to anyone. Oh, listen, I received a copayment. Can you give this person a receipt? Don't. Did you receive the money? No. So then you don't give a receipt because your handwriting is going to be there and your initials are going to be received there because you received the money, but you didn't. Now you're responsible for that. So don't. If you receive the copayment, then you give them a receipt. But if you didn't, somebody asks you to give them, or the patient returns back in a different day, and he said, oh, last time that I was here, oh, you guys didn't give me a receipt for it. Oh, yeah, I'm going to give it to you. Well, how do you know that the patient actually paid for it? And you're not going to go, okay, who took care of you? Because, it wasn't me. So never do anything that you're not sure about it, and don't do favors to no one, because that will eventually go against you. Stay away from all these issues. Collection regulations, efforts to collect past due balances are strictly regulated by law and by the office policy. So there is this law regulation that is called the Federal Trade Commission enforces, and the Fair Debt Collections Practices that was enacted in 1977. You don't have to know the date, but you need to know that the Fair Debt Collection Practices is telling you, see, the title is telling you, this law, Debt Collection Practices Act. So what is exactly this Debt Collections Practices Act has to do with, somebody who owns money? Well, that you can use this law to claim the money that is owed to your office or to you. But then it has certain regulations on how you collect the money from that particular source. So that's basically what it is. So there are certain ways of collecting the money. There are certain words that you should be using, utilizing on those letters or those phone calls. Because collections are very common way of you being called or receiving a letter or notification of a bill that is, but it's past due. So that's basically what it is. So collection letters are generally professional, courteous, just as it says. Oh, up it right here. Just as it states right here. See, letters are generally professional, courteous, brief, and to the point. You're not gonna go there and start explaining every single detail. No, you have to go. Okay, let me see if I can do this. Oh, for some reason, not allow me to do some stuff. Okay, so basically that's what it is. So professional meaning, you're not gonna treat the patient differently. It's a professional letter coming from your office. So you have to state the date that the letter was sent and what is the purpose of the letter. So usually you're gonna tell them that you are a client there, you receive some certain services, and that there is a balance due to be paid for these reasons. Basically, that's what it is. If you have any difficulties, any inconveniences paying this bill, we can make some payment arrangements. We invite the patient to the office to discuss this in a little more detail and in person. That should be stated in the letter. This is not a threatening letter. Hi, Mr. Smith. According to our records, you own us this much money. How are you going to pay? Cash, debit card? Okay, we need this to get paid right away. That is not a professional. That's not a courteous. It is not a letter that should be written that way. So it has to be very professional, very sensitive, because, and most importantly, very courteous. If I talk to you in a very nice way, I can get places, I can get answers. Once again, some people don't pay just because they don't want to pay. Some people actually are having hardships with money. They're probably not working. They are sick. They probably don't have someone who support them. And we don't know. Some people, might just don't want to pay us because they were considering that, that was the obligation of the insurance company. But it's not our decision to know. And how do I know what the patient is thinking? Why the bill has not been paid? What the balance has not been paid? So that's basically how it is. So usually we call the patient, said, hi, Mr. and Mrs. Smith. Oh, this is a bird from Dr. A's office. I'm just going over your bills from last month, and I can see here that, you still have some balances. If you have some time, you want to stop by the office and we can discuss maybe some payment arrangements. Be nice. If the patient said, oh, no, I don't, no worries. Sure, not a problem. You have a wonderful day, and then you send them a letter. A letter, they're going to read it. They're going to be kind of trying to digest this, only because it's very courteous. Once again, they're not going to get offended. But if you see something there that you don't like, then that's it. You're going to just stick by that, and you're probably going to refuse making payment. But if I'm telling you that you have options, that you can pay weekly, you can pay monthly, give options, because it's better for us, to take a little time to get the money versus not getting the money at all. None of these letters should have there any threatened statements. Well, failure to pay this bill, it will, have consequences. Until you pay this bill, you cannot receive more services from our doctor. That is a threat, and that is called abandonment. Immediately, this patient can use that against the office and sue the office, not for $100, $300, many $1,000s. So who's gonna lose? So for that reason, they have to have someone who is really well trained in collections, because you need to know the law. You need to be abide by these Fair, Debt Collection Practices Act. Because if you don't, then you're getting the company in trouble, and you're gonna lose whatever certificates you have, or you're gonna lose your job for not knowing how to deal with your customers. Now, let's say if it is written here. Both collection letters and phone calls are integral parts of the collection process. These are the simple, most common methods of, addressing this situation, collecting this money. Phone calls are the first thing that we do. But whether we use phone calls or letters, remember, we have to be very professional, very courteous. Avoid any wording that might, indicate that, that we are demanding to pay that. Give options, be nice. So that's how it is. So here it is a little sample when it reads that, that the insurance company has pay portion of the services, so the patient is, responsible to pay the balance, kind of. So that's basically what it is. Now it says right there, accounts that are further past due will receive more aggressive letters. False. That should not be true. Aggressive letters do not. It's just that, you're not going to go anywhere like that. These aggressive letters do not work, believe me. What aggressiveness means is like, this has gone over, 3 months. So now these collection letters are going to be sent to a collection agency, and we want to avoid that. That's what I would call being a little more aggressive, because people don't want to deal with collection agencies. Remember that the first collection attempts are done by the office, by the billing department. When this no longer is successful, or it is an unsuccessful try, then, it is time to go to collection agency. Now, in order to send your past due to a collection agency, it has to be certain amount of money that kind of merits that it works, that it makes sense to do the collection. Because if you have to pay more, the collection agency wastes time for a couple of dollars. Oh, you owe us like $35, $60, $100. If it is less than $200 or $500, they don't bother. They don't bother sending you to collection. They might just try, but it doesn't work. Because it's not worth it, the effort. It's too little amount of money. So the medical doctors usually do a write-off. So it's kind of, hey, we know that this money we're not going to receive this, just remove it from that bill. So that's basically that. Now, if it were services for something that was over $1,000, things change a little bit. Because think about this. Do you think that a collection agency is going to work for $30? You owe me $300, and you're going to get 10% out of that bill if the patient pays the entire thing. Because usually they don't pay the entire thing. They said, okay, we're going to give you a breakdown from this. We're going to give you a, you don't have to pay the whole amount. So if you pay $200 within the next 24 hours, so then that's the money that we're going to charge you. So you think that a collection agency is going to work for $30, $20? That's not even the minimum wage for an hour. And how long do they spend sending letters and contacting the patient? Numerous times. So no, it won't happen. So other things that usually collections do not do to the medical bills is that they don't send you to your credit report. Usually your credit report is not affected by money that you owe to the medical doctors. That's last time that I was checking that out. I don't know if regulations have changed lately, but that's what I found out. So again, it's good to know for us, but these are not the things that we're going to tell our patients. Oh, no worries, don't pay because, eventually they're going to give you a write-off. No, because remember, we work for that practice and we need the money to come in because that's work from our people that needs to be compensated. And that's part of the money that probably we're gonna receive in our salary. Just for you to know and how to deal with all this. Because we need to be, once again, proactive in our organization, bring, whatever, money is owed to the office, try to get them. This is the place where we work, so we gotta be kind of, honest to our company. Okay, so credit arrangements and payment plans. Equal credit opportunity. No, I don't think so. That is here. So let's go back to the collection. To the Fair Debt Collections Practices Act. Collection agencies should not call you after certain hours during the week. They should not call you certain days during weekends and holidays. So be careful with this. So most of the time you see medical doctors ask you to call this particular patient, reminding them about money that you owe, but they owe to the office, but you have to be very careful. Because you cannot call patients before 7 in the morning or after 7 p.m. Think about it. Weekdays, Monday to Friday, you should not be calling patients for collections during these particular time frames. Before 7 a.m., after 7 p.m. I know probably what you're thinking. Oh no, they have called me at this time. 7 p.m., 8 p.m., 9 p.m. They call me on weekends. Well, this is the problem, and this is something that you have to take in consideration as well. So all depends on the time zone where you are at. So be careful where they're calling you from. Because if they're calling you from California, they're calling you from another state that the time zones are different. Well, over there is early. Here is a different time. So that's one of the things that they can go, past this. But we don't know because it's 8 p.m. right here, but they're calling me from another state that the time zone is different. Maybe over there is 4 p.m., 3 p.m., but here we have a different time. But these people that works over there, they have to know what time zone do we have here because they violated my law, even if they are a different state. So they should not threaten you when they call you. They should not tell you that if you don't pay, their attorney is going to be in charge, that their attorney is going to play, legal issues against you, so on and so forth. That's illegal. So no calls before 7 in the morning, after 7 p.m. No calls over the weekends, at any time. No calls, holidays. Nobody should be calling you for collections, holidays, weekends. No call should be done to your workplace. So they should not be calling your employer to tell you, hey, your employee owe me some money. They should not do that. That's illegal. They should not call you during the time that you're working, because you're supposed to be working. And if you don't answer the phone, then it's not because you don't want to, it's because you're working. So there are lots of things. That's what it's called, these fair debt collection practices, because it has to be fair for you. Even though if you owe money, you still have some rights. We have some rights. And they have to respect that. What happens is that some people just do whatever they feel like it. So be careful with that. And they don't follow this because I was called by a collection agency out of nowhere. I don't know where this was, in California. I never lived in California to begin with. That's at the beginning when I moved to this country. And they were asking me for some money for some car that I had purchased over there. I said, listen, you're wasting your time. Says, oh, well, if you don't pay, then, our attorney is going to contact you and you're going to be in deep trouble. I didn't know anything about these fair debt collection practices. I didn't even know English. Then I put my father-in-law and I said, oh, listen, someone is calling me and says something about a card and some money, but I don't know what it is. So let me deal with them. And well, he explained, because he knew about all those things. So he explained that, so listen, what are you calling me? And besides, my son-in-law having lived in that place. He doesn't even have a car. What do you mean that he has a car, he purchased a car? He's driving my car. So clear up that. But I was threatened. People do whatever it takes to get the money because they know that sometimes you as the client, you as the customer don't know the law. So you don't know. So you don't know that all this thing exists, that there is a law that protects you. Even though if you own money, they protect you. They cannot violate your rights. So that's basically what it is. So it's very important for us to know that. So remember, if somebody asks you to call patients after hours, listen, you leave at 5, you can use 5 to 7 to call someone. Do not go over 7 because you can get in trouble. Not your doctor, it's you. Your doctor is going to say, oh, no, I told them, to work, after 5 to 7, or just call for an hour. And then start calling at 8. You know why do they call you after 7? Because that's the time that you are at home. You know what they call you weekends? Because that's the time that you are at home. So you think, hey, now I can get this person. I can get to hold on to this person because it's at home. Oh, you already came from work. If I call you during the working hours, I know you're not going to respond. So I'm going to catch you when you get home. But that's illegal because that's your time for you to rest. Because there is a law to protect. Even though if you own money, we have rights. Think about it. So don't forget about that. So there are other, organizations like Equal Credit Opportunity Act, the law that prohibits credit discrimination based on, we know the things about discrimination based on race, color, religion, national origin, sexual orientation, marital status, age, anything. So you cannot deny credit, and that's part of, all these agencies. So you cannot go to a medical doctor's office and because you don't have health insurance or because you are from this particular country, they're not going to offer you, render services, no? Later on, you're going to see how you're going to pay, but by the time being, particularly emergencies, we're talking about emergencies because part of the health system. Your primary doctor can refuse to offer you services if you don't have money, if you don't have how to pay. I can refuse to see you, but emergency cannot. So because we don't know where you are receiving the services from, and the emergency is one of them. So, well, we're not going to leave it open. We're going to leave it there. So that's basically how it works. There is another, law that protects or act that protects us, the Truth in Lending Act. So this is the law that requires disclosure of finance charges and late fees for payment plans. So remember, before you're going to be charged for something, you have to be explained. That will tell you in details. That's why every single time our patient comes to our office for the first time, we're going to disclose all this information. Listen, this is what you're going to pay. This is what you're going to be responsible for it. If the insurance doesn't pay, you're going to pay. So the Truth in Lending Act has to do with that. You have a copayment every single time that you come to the office. You need to disclose that. You need to disclose every single thing, because if the patient doesn't know and receive the services, how are you going to charge them for the services? You can explain them. So that's basically what it is. So if the patient doesn't have money to pay for the services, then how are you going to go about if you didn't explain them? Even though if you explain them, but they don't have money to pay, sometimes you have to offset, sometimes you have to do write-offs. It's like, hey, you don't owe us anything. So if you don't owe us anything, then, it's like your bill is paid. Just continue for the services. We're just going to receive whatever the insurance is going to pay us. So that's basically what it is. Because most of the problems, most of the money that we collect is balances. Because if you want to receive services and you want to pay from your pocket, usually you have to pay up front for the services. Because remember, the services, the evaluation and management. You're going to tell me what's going on. I'm going to be examining you. I'm going to be probably ordering some tests. But if you don't have money, I have to explain to you, listen, blood tests, we're going to order these blood tests. This is going to cost you this much because the patient is paying in cash. So if the patient doesn't want to do it, not a problem. Because when the patient do the exams and they get the results, they have to pay the laboratory for those. But they have to be told, remember, the truth. And Lending Act is one of those laws that, obliges medical professionals or any other organization to disclose these financial charges. You had to. Can't just let it out. Oh, no, I'm not going to tell you. No, you have to. Payment plan. So as I mentioned before, we're going to offer payment plans to our customers, always. Because it's better to receive some money than not to receive anything. So if you're going to pay us, we are going to be very flexible. You can pay weekly, bi-weekly, monthly. We're going to give you a certain amount of, we're going to make arrangements on how much you're going to pay, whether weekly, bi-weekly, or monthly. As long as you pay us, that's all we need. Particularly for those patients who are having, hardships, having problems, they don't have a job, they don't have enough money. And sometimes the service, the bill is a little high. If it goes over $100, this is a lot of money for patients who do not have money, can barely get by with the daily, expenses. So we have to be a little flexible with it. Okay, so let's take a little break, and when we come back, we complete this, plus a summary that I have there, certain important things that we need to remember for your workplace, because most of this is more likely for what you're gonna be doing. So when you go there, you know exactly what's going on, or at least, you have an idea and you know who to ask. So you don't make mistakes, because you really want to learn, you really want to do your job well, you really want to stay in that job. Okay, so we are going to come back at 7:40 and we're going to wrap it up with this chapter. We're going to go to a summary, and that is it. We're done with this module. Okay, so enjoy your break. See you 7:40, and we continue with this chapter. Okay, see you later. 7:40. Don't forget.
Thank you.
You're welcome. Take care. Oh.
Colia, go, go, chiquitito, go, go, tía, mi bebé, eh. Ese niño me saca muy tanta risa, sí. Él es el único que sabe, como cuando uno está down, y él dice, ven, que te voy a subir los ánimos. And okay, baby, thank you so much, mi reina. Bebé, bebé. Liam de tía. Bebé.
Okay, so we are back. I hope you guys enjoy your break. We're gonna continue with this patients billing and collection chapter. We're almost done, and then we're gonna do some type of review, some of the parts that I want you to know in detail. So that will be it. So we were talking about the payment plans. So every single office has to have a payment plan arrangements, because once again, the most important thing is to get paid. Even though if we have to wait a little longer, it's better pay late than never. So basically, that's what it is. So each office is going to have their different policies of how these payment plans are going to be conducted. So it is up to each office. But most of the time, once again, they give you the chance for the patient to pay small amounts of money. That's called installment plan, which they can eventually pay within certain period of time without incurring in late fees or anything else. So that's basically how it works. Now, it will be convenient to do these payment plans prior to the service render, but most of the time it doesn't happen that way. Things change overnight. Patient situations are, evolving, revolving. One day is one thing, another day is another thing. Whatever is happening today is not going to be what is happening tomorrow. We have a job today. We might not have job tomorrow. We have a sicker person today, or maybe tomorrow. So once again, it's a very difficult situation to kind of unforeseen, what's gonna happen later on in life. Sometimes we can make payments, sometimes we cannot. So that's part of life. But when they gave us the opportunity to pay, some overdue or past due uh, money, well, if we have these arrangements, that can be a lot more factible to pay than actually, requesting to pay the entire or the whole sum of money. So that's basically how it is. We never ready or, plan to have any issues in the future, but things happen. So we have to count with those situations as well. Selecting or using a collection agency. Now, once again, after this money is being overdue for more than 3 months, usually is 120 days, or some other organizations are start sending collection to a collection agency after 180 days. So 120 days, 3 months, 4 months, usually is the time, because after 90 days, it becomes, delinquent account. So usually they give you a little grace time for you to pay, and we continue call from the office. But if you don't get these payments from the patient, then they use a collection agency. Once again, these are external organizations that do just that. That's what they do. They collect money from debtors, and usually are very effective in certain cases. So that's basically what it is. Once again, they contract with them. They have certain percentage that they're going to offer to them. But these collection agencies also needs to abide by, the Fair Collection Act, which is, call you at certain hours, certain days they cannot call you, so on and so forth. So whatever I covered before about, us calling the patients after 7 p.m. or before 7 in the morning or weekends or holidays, that is prohibited by law. So the collections agencies should do just exactly like that. So that's how it works. Remember, collection agencies are the last resort. After several attempts to try to collect the money from the patient and we fail, now there is no other options. But once again, the amount of money that we are going to collect or that the patient owns to the office has to be certain amount of money after certain limitations, because other than that, it's not worth it. And the insurance, the collection agency will not, go for it if it's not enough for them, because this is business for the collection agency as well. If they're not going to get enough money for collecting your money because it's not enough money to be collected, then, the medical office might decide to do a write-off or kind of, try to negotiate with the patient to pay half of the money or, 30% of whatever they own, and they can continue receiving the services for the money, so they can pay something. It's better than not collecting anything. So basically, that's what it is. Remember, if the patient has been in the office for a long time, usually the medical doctors, they just do a write-off. They're not gonna go through all these processes of collection agencies or anything like that. Because it's time consuming, and sometimes, you just lose the customer and they're never gonna pay you back anyway. So we better keep on collecting the money that the insurance paid us, even though if the balance is not canceled. So that's how it goes. Credit report. So for credit reporting, remember, law requiring consumers reporting agencies to have reasonable and fair procedures. Now, once again, few years ago that I checked, haven't checked lately, how it goes about with, reporting these health services fees that has not been paid to the office, to the credit agencies, So it wasn't required. Now, hopefully still continues with the same. So once again, we just have to verify how that works now. But like few years ago, before the pandemic, it was not. So I don't think that things have changed much. So types of uncollectible accounts. So these are the accounts that, we're not going to be able to collect for some of the reasons that we're going to mention later on. Not all balances due to the practice will ever be paid. So one practice must determine to write off an account. Remember, I mentioned that whenever we cannot collect those past due fees, well, one of the things that the agency or the hospital is going to do is just to write it off. Remember, if there is an amount that is not worth it to fight and to lose the client or the patient, so might as well, just write it off. Uncollectible accounts, money that cannot be collected, must be write off. So that's basically what it is. Well, let's remove it from the account. Let's zero that account. So that's basically what it is. So bad debt. So it's an uncollectible account. We know that account, we have made so many attempts to collect the money. Still, we cannot get any results. So write it off. Bad debt. This person is known as someone who doesn't pay. So what are you going to try to do? Try to harass the person again? Well, no. So then it becomes an account that it is deemed uncollectible. That is it, period. That's why when you're going to purchase something and you need some line of credit, they check your credit report, your past, accounts, whether you pay on time, whether you did not. Now, if you're a risk person, they will not approve you for the new credit or line or loan, whatever the case may be. So that is the reason to check, because remember, everybody who does business, they do business with a purpose, right? To make some profits. This is not a charitable, organization. So somebody has to pay for those services. And because you're the one who received the services, you are the one who's going to be liable for those services. You are going to be responsible for those services. So that's basically what it is. If you have a bad credit and we know already, well, chances are we're not going to get paid. If we have gone through this process before with the patient and we kind of, try to settle with a write-off, well, we know that this can happen again. Means test, process of fairly determining a patient's ability to pay. I mentioned it already. When they go through all these, accounts that we previously have, and they do like, an audit or a monitoring process to evaluate whether we can qualify for that particular, loan or some type of line of credit. So they're gonna say, no, you do not qualify. Unfortunately for, this type of billing processes is a little difficult because most of the time, the insurance covers most of the part of the services and the patient is just, responsible for very small amount. So they don't bother much because of that part. Yes, we want the 100% of the money, but if we cannot collect the whole amount of money, it's not a big deal. So that's basically what it is. Because remember, the insurance is going to pay most of the amount of the money.
Professor Hoyer, I have a
Go
question.
ahead.
So how does it work with children? Like, say a child, they're not really responsible for paying their medical bills. So like, say as a child, they had like their parents made them have a poor payment history, but then like, you age out of pediatrics. Does that still follow them, or do they get like a new like credit history, if you get what I'm saying?
Yes. Okay. So there are two things that we have to talk about pediatrics, because remember, pediatrics patients, minors, they are not responsible for any bills, for anything at all. So if the services are provided to the child and the parents are the custodian, they are the ones who are responsible for the bills of the child. So that's basically what it is. Now, if the parents have a private insurance, they definitely gonna be billed. If they have, this child program, they will not be billed because this is the government paying for the children. They have special protection, special situation when it comes to healthcare services. Whether you are, whether you have an insurance, your parents have an insurance, or whether you don't have an insurance, children usually have this particular protection for being a minor because they are not considered the responsible party for the payments or any services. So that's basically what it is. So once again, if the parents have a private insurance, they will be responsible. Whoever is the custodian of this child is going to be responsible. But if you have a government insurance, child is covered 100%. They will not send you bill for, the charges of your child. They might try, right, to see if they collect, but they cannot send you to collections. So that's basically something that protects children.
Okay, thank you.
You're welcome. Any other questions? So bankruptcy. So we know now, or probably you don't, bankruptcy is when you no longer can afford to pay for anything because you lost your job, you have some medical issues, you cannot work, so you don't have an income. So you are bankruptcy. If you have business and you lost your business, you went bankruptcy. You couldn't afford it, you couldn't keep up. So if you owe money for anything, you were paying a car, you were paying your house, and you go bankruptcy, they cannot, by no means, send you to collections. Just the fact that you file, but you have to file for bankruptcy. Then most of the private money that you own, it will be settled. It will be removed from you. But you have a problem that your credit is really bad. So for the next 7 years, from the moment that you kind of, declare yourself in bankruptcy, you will never ever, for during those 7 years, nobody will ever lend you no money. You will not be able to have, and you're not going to be able to apply for anything anyways, or buy anything, because if you buy something, how you bought, where was the money coming from? So usually bankruptcy is another thing. Remember, that protects people from the debtors. If somebody, you owe money and they want to collect the money and you already have filed for bankruptcy, these collectors cannot collect your money. That is definitely the case. Now, for certain governmental institutions, that is a little different, but still, you might have the money not doing a write-off. You might give an extension to pay later on. If it is like government, money, then you will give like this time or extension time for you to pay later on when things gets better. But the money will not be removed from your collection. If it is private, unfortunately for private business, because these are for profit organizations, they will definitely cancel whatever debts you have with these organizations. So there are certain, once again, situations in which, you can, get away with not paying some dues due to the fact that you're going through all these situations. If you have, an uncollectible account, bad debt, or bankruptcy, again, and if they do the means test, they're gonna find out that you are not, qualified for this type of loans or credits online. Well, they're just not gonna approve you. But you're not gonna go into that. It's just that you're not gonna get what you're applying for. The other ones, you already own the money, so you're not gonna be able to qualify for it. So that's basically what it is. Patient refund. So let's say that the doctor charge you more for the services that the insurance approves, or they pay you through two different insurances, different amounts of money, they make mistake. So that money has to be refunded. To who? To the insurance? No. That money you have to give it to the patient. If you, for any reason, you charge more, or the insurance return you more than you were supposed to receive, that money, you cannot keep it. Oh, excellent, they make a mistake, they pay me more. Oh no, they're being nice to me now. No, that's not the case. If you receive more money than you request for in your claim, the money doesn't belong to you. You do not return this money back to the insurance company. You give it back to the patient. And you keep, of course, a receipt that you have returned the money to that, because this will be called fraud if you don't. So again, it's very sensitive, all the situations. So you got to make sure that an overpayment for any services to the patient needs to be sent back to the payer or to the patient, whichever the case may be. Because remember, sometimes the patient has a balance, so we send them the money to them. Or we can kind of, balance that with whatever money is being pending from the patients for the balance that they owe. So either or, but once again, if something like this happens, you have to read your policies and to determine if this money is going to go to the patient or this money is going to go to the insurance company. So that's how it works. So that will be the job of the billing person, depending on what situations have happened for the overpayment. So that's basically what it is. So remember that back in the days, the insurance reimbursement was done to the patient, and then the patient was paying the provider. Now it's not like that. Now it goes directly to the provider, but when the provider has been reimbursed or it has issued an overpayment, that money has to go back to the patient, or depends on the circumstances, has to go back to the insurance, but most of the time it's to the patient. But you have to document this, because remember, the patient is going to receive the money. You have to have a documentation that you actually refund the money back to the patient and that you did not keep it, because that can go against the practice. So that's basically how it works. Record retention. Now, remember, we are talking about not the medical records. We're talking about these financial records. Remember, these financial records has little difference between states, but most of the time it is required to retain these financial records for 6 years. Remember, that is a HIPAA regulation. Now, if we talk about medical records, remember, in general, we have to retain them for a period of 7 to 10 years. So you just follow the policies of your organization and the state where you are, because it varies a little bit from state to state, because they have their own policies, their own regulations. So if for any reason these documents are required and you don't have it, and the statute of limitation to retain these documents has not lapsed yet, this medical office is going to be in trouble, or any industry for that matter. So that's basically what it is. So it has to be kept at least for 6 years. And after that, you can do anything you want. You can keep it, you can destroy them, you just can do anything you want once again. So that's how it works. Okay, so we are done with this chapter. Once again, we have another part of the chapter, but this is not a chapter. This is kind of bringing back, summarizing some of the important points that I want you to know for the purpose of your job. Because believe me, this is going to be very useful, particularly if you have to be in the front of the office. Not knowing these processes and requirements and policies and documents might get you in a little trouble. The worst thing that can happen to you, remember, is that when you don't know something, you're just gonna ask someone else, because we're not gonna know it all. But it's a good thing to have some basic knowledge, so when something like this arises during our job activities, not only that we know how to handle, but that we know that we need some assistance from someone else. Remember, when you're in doubt, always ask for the system, ask for someone else who's been there longer, how it works. Even people who's been there longer don't know how to do things, because some people don't like to get involved. They just, throw the ball to someone else and they never learn. Oh, no, that's not my concern, so I'm not getting involved on that. I'm going to pass this to someone else. Well, it is good to, refer these situations to someone who knows better, but isn't it good that you should be learning from it? So next time you can solve these issues yourself and, work as a part of the team, because that's what's important. So once again, it doesn't hurt anyone to be familiar with all this material, particularly because it happens right up front. And sometimes if we are not prepared, we're gonna look like, we don't know what we're doing. And you don't want to be in that situation. You don't want to have that feeling, because that feeling makes you, uncomfortable, like not competent, like you do not belong to the particular place. So that's basically how I want you to see it. So the most important thing is just, be there, do what you have to do, learn as much as you can, because if you don't, then, you're going to be missing out. And remember, the opportunities to be promoted is when you actually, show interest, you are part of the team, when you are assisting most of your clients over there in your workplace, when you are professional, when you are polite, when you are courteous, when you are willing to help, when you have compassion, when you are empathetic. That's what gives you the job. When you are on time, just going to your job and, I'm clocking at this time because that's the time that I start, and I'm clocking now at this time because it's time that I finish that's not what, employers are looking for. They're looking for a team player, and a team player is someone who, if he doesn't know something, is going to ask and is going to learn, and next time you're going to do it. So you don't have to depend on other people. That's not going to get you in trouble. If you know the answer, just be professional. Don't give too much information to the patients. Just go to the point. And if you're not sure, get someone else. Direct these patients to the proper, to the appropriate source. So don't mislead them. Just pretending that, you want to make believe the patient that you really know what you're doing. If you don't, just don't get involved. Period. That's what I would do. When I don't know something, I don't get involved. But I do assist the patient getting someone else. And I stick around to learn what is it that this person is going to be responding to the patient, so I can learn. Because remember, we like people who are proactive, someone who is continuously learning, not someone who just do whatever they've been told to do, and that is it. That is not good. So you wouldn't be ready for, for the promotion, for a pay raise or anything like that. So work for it. It's not difficult. Okay, so let's do some summary right here. Very important points that I want you to remember. I will be asking you most of these things on the exam. I'm not going to give you too many questions for this exam, but I do want to focus on things that you might be doing on your job. This is important. Remember, HIPAA, you can't ignore HIPAA when you talk about medical. It is the core, because it has to do with protecting the patient's information, period. Law and ethics, because you're protecting the rights, not only what constitutes HIPAA, but the patient's dignity, the patient's rights as a person, their beliefs, whether they are right or wrong. So we are not there to judge anyone. We are there to take care of everyone. We have to be very empathetic, remember. So 3 steps to establish financial responsibility. So once again, this is something that you're going to encounter every single day. This is every day's task. Why? Because in your doctor's office, in the hospital, you're going to have all these patients coming to visit, to encounter with the doctor for any reason. And for those encounters, we're going to charge them. We're going to use the insurance card because that's how it is. Now, if we have patients that they were cash patients, we wouldn't be so worried about verifying, insurance eligibility, because that would not be something that we will be concerned with, because there is no need. But remember, more than 60, I believe that 80% of the population that comes to the medical office, they have some type of health insurance. So patients' insurance verification should be the first step when the patient comes into our office. Remember, if we do not verify that the patient has coverage for that particular day, we are not going to get paid. The insurance is going to deny those services. This is 100%. Don't even bother appealing for the rejection, for the denial, because it will not go through. You didn't have coverage during that day. How am I gonna pay for those services? And that might be our responsibility because we did not verify the patients. Remember, ask the appropriate questions. Get the habit to ask the patient every single time the patient comes to your office. Has your information changed? Are you still living in the same place? Is your phone number the same? Your email? This is very important for us to know. Your address, are you still living in the same place? All this information should be asked, remember, taking in consideration HIPAA privacy rule. You're going to keep your voice down. You're going to ask about these questions and, in some kind of, private place. And if it's not, lower your voice or ask just the patient, show the screen on your computer. Can you verify your information for me? Still, your information is the same without having to mention all the things. Are you still in the same address? Are you still, can you give me your number? No. Oh, no, my phone number have changed. Okay, let me have your new phone number. And then usually ask the patient to write it down. It's better. You don't want people to hear somebody else's number or any other information like your address. You don't know who's sitting in the waiting area. Remember, part of the HIPAA privacy rule is that we're going to keep the patient's information private. This is not confidentiality because we're not releasing the information. We're asking for information, but we don't want, other people to overhear what the patient is responding to us. So patient verification, coverage insurance is a key. Making sure that we have all the information from the patient that is updated, very important. We need to contact the patient, but the information is outdated. How we're gonna get there? So it's important. It might be an important, lab results consultation that we need to do with the patient. Not necessarily because we are going to collect money, no, but that is also important because the office without financials doesn't work. The next step is determine pre-authorization and referral requirements. Do the patient need pre-authorization? What insurance the patient has? Because that's what show us when we receive the insurance card. We're going to see what insurance is it. And if in front of the insurance card, there is a name of a doctor there, this person has an HMO, a health organization management or health management organization. which is the one that controls everything, limits you. This is the one that has a gatekeeper, a primary care physician. You cannot see someone else. You have to see this medical doctor before you go anywhere else. So just looking at the card, you already know. So you don't even have to ask the patient. Looking at the card, you can see whether the patient has a copayment right there and how much it is. How simple is that? Just looking at that insurance card, you know a lot. Oh, this is a Medicaid. This is a Medicare. Oh, group. This is an employer's sponsored insurance. Now, if you see Medicaid, Medicare, probably they don't have a copayment. They don't have anything. No worries. And if they have, mostly is the pharmacy when they're going to claim the medications. So you shouldn't worry about that because you worry about what fees needs to be paid to the office, what fees you need to collect right there while the patient is there. So you see how important it is this first step, just checking that insurance card, you're going to find out so much stuff. And you're going to become really good at it. But if you don't know, you're going to be asking the patient all the time. So that's how you verify things. So you can kill like 6 birds with one stone. Not only check, verifying patients, eligibility coverage for the particular day, but also you're gonna know what type of insurance the patient has, whether it has a copayment, whether it needs pre-authorization. If it needs a pre-authorization, you know already that this patient needs referral for any procedures and certain medications as well. So it's very important for us to understand all that. And we know already that this patient has an HMO. Probably this patient might have a prepaid. So you don't have to be worried about, asking for copayments or anything like that because it's not written on the card. You don't have to. If it is in Medicare, you're going to be seeing written there, Part A, Part B. So you know already that this patient has coverage for hospitals, A, B, medical offices, outpatients. Looking at the card, and if this medical insurance is going to be the primary insurance or the secondary insurance. So if it is the primary, then no worries. If the patient doesn't show you the other one, hey, you're going to ask, do you have another medical insurance by any chance? So that's how helpful it is to know, and to see, to have right there in front of you the insurance card from the patient. Remember, it's not just having an info, it's just have to verify. You have to go in through the system or any other devices that you have to verify the patients. It's not just asking for the insurance. Oh, I see the card. Yeah, that's you. That's not enough. You're doing half of the work, but half of the work doesn't mean anything. You have to do 100% of the work, which is now entering this ID number in the system and getting the printout right there that states that the patient have insurance coverage for that day. So we claim we're going to get paid, not a problem. We don't have to bill the patient. So the money is already in our pockets, not our pockets, the office pocket. That's what I meant. So that's basically what it is. See how important it is for us just to follow these steps because financials are the most important thing. Think about you without money. Money is so important that there are certain things that cannot be done without money. 90% of the things that we need needs to be paid. We don't get anything for free. Nothing. So money is important. If it is important money for you, can you imagine for an office, for business? It is very important for everyone. So we got to make sure that we do that. And if you do that, guess what? Someone is watching, someone is monitoring this, and he says, wow, this person is the one that has to be here working with us. And if you move to another job, you're going to have a good recommendation when you move because you're doing your job the way that it's supposed to. But if you're someone who do not care, just go there because you just have to be there because that's the only way that you're going to get paid because they're going to see your face. That is not enough. You have to do some job, get some results. That's how it works. So here is the pre-authorization. Pre-authorization is requested before a patient is given certain types of medical care or services. And remember, this pre-authorization happens with these HMOs, health management organizations. Now, if you're going to refer the patient to someone or to get certain procedures, you first need to contact the insurance company, and they're going to give you an authorization number. And when this authorization number is the one that the patient is going to go to get the procedure to consult with these specialists. Because that specialist is going to look for that authorization number. Oh, what is the authorization number? Oh, do I have to have an authorization? Sure. Oh, they just make an appointment for me. Yeah, but you need an authorization number. So remember, that is our job in our office. This is not the job for the person that you're referring to. It's the referring physician's job to get the pre-authorization for their patient because we are the one who are sending this patient to get this procedure or this particular service with another professional. So it is our job. So be careful with this. So don't leave this to the patient because the patient doesn't know how to get the pre-authorization. It has to be done by us. We are going to call the other office where we are going to be sending the patient. So that's basically what it is. So we're going to contact the insurance company of the patient and get this prior pre-authorization number, and then we're going to set up an appointment for the patient to send it to this particular procedure or whatever the patient needs. We have to have a number. Without the number, the other provider is not going to take the patient. And the patient is going to waste their time going there, not getting the services that they request. So be careful. No-show policy. So in general, see, some of the offices, they charge a fee if you do not show to the appointment. So that's basically what it is. Now, missing an appointment, meaning you did not call, you didn't do anything, you just did not show up. You did not show up. So that's it. It's called no show. And remember, no show, it is written NS, no show. If you have a question in your exam, no show, NS, no show. That's it. That's how you spell it out, or this is the acronym. They have their own policies, how much they're gonna charge. Some offices, if you do not cancel at least within 24 hours in advance, they're gonna charge you a certain amount of money. Some offices charge you a percentage of what will be charging for the fee of services. Some others will charge you the entire fee of services. Because remember, if you do not show up to the office, that means during that time slot that I have scheduled you, nobody else is going to use it. So we're going to lose that money. And we cannot afford to do that. So it is legal now. It is approved by the insurance. We can charge for that. So that's basically what it is. So just make sure. Some offices are very strict. If you arrive to the office 15 minutes after your appointment late, they're just not going to put you back and say, okay, you're going to be seeing the doctor after this patient because you were late. No, they cancel your appointment. You have to reschedule. And that means you have to pay a fee for it. So This is for you, so you can follow your appointments whenever you have your appointments, but also for your patients. So explain the patients when you give them an appointment. Remember, you have to come to the appointment. If you cannot make it, please call us within 24 hours or more in advance so we can assign this slot to someone else. Remember, failure to do so, we're going to charge you a fee, not for Medicaid. So don't waste your time with Medicaid patients because they're not going to pay anything. Talking about these, group insurance or employer sponsored or private insurances. Anyone else is a little difficult. So what are the things that we should do to reduce these situations that the patients, do not show up? Use automated appointment reminders. So remember, when someone has an appointment that is being given in advance, you're not going to remember. So what is it that you're going to do? We talk about this when we talk about scheduling appointments. You're going to send them a reminder, whether it's automatic reminder or you're going to make a phone call a day before. Hey, Mr. Smith, Miss Smith, this is Alberto from Dr. A's office. Just to remind you, you have an appointment tomorrow at this time, okay? If they have any restrictions or things that have to do prior, remember, do not take your medication. Remember, do not eat anything from this period of time. You have to be fasting. Remind them, because otherwise they're going to waste their time coming to the office because things are not going to be done. So basically, that's how it works. And we're going to be rescheduling them if anything happens. So we always going to give them the second chance, but we're going to, let them know, we're going to advise that it is very important for them, to keep their schedule because otherwise they will be charged. Knowing that they're going to be charged, remember, they're going to be more compliant. So that's basically what it is. So we always going to explain, and when we explain to them the penalties that you have to go through for not, showing up to the appointment, you have to be very polite, very professional, very courteous, just as, that were you were receiving the information. Copays. Remember, copays needs to be paid by the patient. This is part of the arrangement between the insurance, the provider, and the patient. So the patient needs to pay this. There's going to be exceptions to the rule. You actually don't have, you kind of broke, don't have money. Well, that's not imply that we are not gonna ask for that. Yes, we are. We're gonna bill it to you. That's a different issue. So be careful with that, because we cannot waive those copayments. Remember, there are three major categories for patient responsibilities. Patient is responsible for deductible, coinsurance, and copayments, period. Because the insurance will pay after all these patient responsibilities are deducted from the premium. They will be responsible for the rest. So the patient has to pay the balance. This is the balance: the deductible, the coinsurance, and the copay. That's something that the insurance will not pay unless you have certain time arrangements or the medical doctor has accepted certain, benefits in advance, not to bill the patient for the balance. That's something else, but the patient has the responsibility for this. Can a patient pay the copayment later? Remember, patients are gonna tell you, I don't have the money now. Oh, can I pay later? Sure, not a problem. We're gonna bill it today. You're gonna write it down. Patient did not pay the copayment. Patient, said that he didn't have no money, so we're gonna bill it today. We are going to do that. Believe me, you cannot waive those copays. Remember, it's illegal. So why is waiving copayments illegal? We talk about, remember, the anti-kickback statute. So remember, we talk about that, sending patients to someone and receiving something in return. It is an anti-kickback statute. That would be a violation of this particular law regulation. So for that reason, we should not waive them. Remember that I mentioned before that if this medical doctor is not charging copayments, patients from other offices, I'm going to move to this doctor. So this doctor is using that as a bait to lure these other clients to move to their offices because you're not charging for something that you were supposed to. Think about, I have 2 stores right here, but this is not covered because this is not medical. And this one sells, the apples 25 cents cheaper than the supermarket next door. Where are you going to go? That's what they compare, lowering the prices. But in medicine, you don't do that. You don't do that. Unless someone's paying you cash, that's a different issue. Hey, we charge $200, but you're not going to pay cash, we're going to charge you $100. That's a different issue. But with the insurances, you don't deal that because you have different contracts with the insurance company and you have to be abide by that. Assignment of benefits, remember, you have to keep in mind these. What is assignment of benefits? Remember, assignment of benefits is when the patient authorizes the insurance company to send the money for the services to the medical providers. This is assignment of benefits. So we need to understand this because if we don't, then we're going to miss a lot of stuff. So remember, assignment of benefits is totally different from accepting assignment. That's totally different. Assignment of benefits is from the patient's part. I'm the patient. I assign my benefits to my medical provider. So insurance pay my services directly to the medical doctor. That is assignment of benefits. Notice of privacy practice. Now, remember, privacy. This has to do with HIPAA. See, sometimes we find some words right there that is going to give us the answer. Notice of privacy practices. So I, as a patient, receive a notice of privacy, how this practice manage my information. So that's basically what it's telling you. So this notice is given to the patient the first day that they register. And the assignment of benefits as well, because they're going to be responsible for whatever the insurance do not pay. They're going to be responsible for the balance or for any services not covered by the insurance. They're going to be received. But that goes within this assignment of benefits. But now the notice of privacy practices, now I'm giving the rights to the medical providers to disclose my information to these entities that are, dealing with my care, with the associates. If they are dealing with my problems, my concerns, I don't need to be signing papers all the time, releasing the information so they can see my information. So that's basically what it is. That's notice of privacy practice. It has to be there. Every single patient needs to be told about it. Accept assignments. Now, think about this. Accepting assignments and assignment of benefits are not the same. Now is the medical doctor that is going to accept whatever the insurance is going to pay them. I'm negotiating with the insurance company because I'm going to take all these insurance companies' clients. So they're going to pay me for this particular service, this amount of money. So I decide if I want to accept those rates of payments or not. If I don't, then I don't sign with them. I'm not a participating provider. If I sign with them, I'm going to be a participating provider. So I have to be accepting anything that they pay me. So that's basically what it means. So if me as a provider, I accept what the insurance company is paying me, I don't have to fight with anyone. And if the insurance company tells me, okay, so I'm going to pay you this much and whatever else you charge for, because it's your, fee for service, but they're not going to pay everything because remember, the patient is going to pay deductible, co-insurance, and co-payment. After the deduction of all this, then the insurance is going to pay. But then if they have an agreement in which, the balance should not be sent to the patient, if you agree, you have to abide by. If there were some services that the insurance is not responsible for, where services that the insurance do not cover, the insurance already tells the patient, listen, if you order something and this is not something that I cover, I'm not responsible for that. So you're going to decide what to do. I don't know if you're going to bill the patient. That's your problem. But me as insurance, I'm not going to pay you for it because I already told you that if it's not covered, I'm not. Now, because you already discussed with the patient, then you cover because now the patient is responsible. If services are not paid by the insurance, you have to disclose this to the patient. Then the patient decides if they want to take it or not. So these are the terms that I want you to understand: accepting assignments, assignment of benefits, the act of privacy, practices, because it is important. So that's how it works. What happens if a provider accepts assignments? I already told you, they have to accept everything that they pay. That's it, that's what you accept. If there was no coverage for this particular service, you're not going to get paid, period. Now you can bill the patient, but if the patient doesn't want to pay you, then you have another issue right there with collections. Now, that is if you accept assignments. Now, what happens if the provider doesn't accept assignments? Then the beneficiary may be billed for the full amount. Remember, this has to be disclosed to the patient. You can't just order services assuming or making believe the patient, misinforming probably that the insurance might cover, and then did not disclose, that the insurance might not cover those and that the patient has to be responsible for it. So you have to do it, you have to be honest. So then you have to bill the patient, definitely. We mentioned that already. Coordination of benefits. See, so many things right here that can be confused. Coordination of benefits. Now, coordination, look at the words. I'm going to coordinate which insurance is going to be the primary insurance, which is going to be the secondary insurance, which is going to be the tertiary insurance, which is going to be the supplementary insurance. So that's basically what it's telling you. So coordination of benefits is to coordinate, to arrange which insurance pays first, second, third, and everything else. So that is how it works. So we got to get familiar with these terms just in case, you get one of these terms just thrown right there on your Excel. But most importantly, when you're working. So you know already that when you ask for the insurance card, you are already thinking, okay, oh, this is the primary. I know this is the primary, because remember, the primary is always going to be a private insurance. Always. There is no question about it. If the insurance card reads, group, has a group number, they are working, or they are dependent of someone who's working, they're going to be the primary. Now you can have two commercial insurances, but one is going to be the primary, the other one is going to be the secondary or supplementary. So you got to make sure that you ask how many insurances they have. So that's how you're going to move around, because other than that, you're going to make mistakes. You're not gonna know all these at once. You're gonna get better as time goes by if you decide, to keep on working on these particular places where you have to be in the front. So many people likes to be in the front. They like to deal with the patient with all these administrative issues. Some people like it. I know some of them. Personally, I don't. I'm more like a clinical person because that's what I was doing. But knowing this, I know how to handle it. It's just that I don't like it, period. But some people rather do the administrative versus the clinical part. So that is coordination of benefits. Remember, it's determining which insurance is the one that, is considered primary or not. So for coordination of benefits, there are certain things that we need to know. Primary and secondary payers. See, the primary payer pays up to the limits of its coverage. So the primary usually is the insurance that pays most of the money after deducting, co-insurance, deductible, and the copay. So that's basically what it is. The one that pays the most. So for that reason, the insurance will not take the secondary because that's going to cover only 20%, though the one covers more than 60%. Dependence. Rules determine. We talk about the birthday rule, remember, because dependence means most likely for children. Because if it is an adult, dependent, nothing changes. You're an adult, you're the spouse, that's it. Your insurance covers. That's it, no problem. But there's a child. Remember, we have situations in which the two parents live together, both of them have insurance. So we go by the birthday rule. Remember, the ones that, the day of birth falls earlier during that particular year, they will be the primary, regardless whether the person makes less money or not. So that's basically how it is. Remember, if it is someone who has the custody of the child, that person is the primary insurance for them. So again, different things. But the birthday rule is very important to keep it in mind just in case, because sometimes I have seen these questions on exams according to the students. So again, just keep in mind. Here are some of the things to know about the coordination of benefits. Medicare. If a person has Medicare and other health insurances, remember, now other health insurances, I'm talking about private. You have Medicare and you have a private or group insurance, which is the employers. Medicare is going to be the second payer. Remember, Medicare, if it is with a private, Medicare is secondary. Now, if Medicare is with Medicaid, Medicare is a primary. Medicaid is the last resort insurance coverage. So that's basic. If you only have Medicaid, well, that's your primary, right? But if you have Medicaid in something else, regardless whether it's private or Medicare, Medicaid always going to be the secondary. So keep that in mind, because it's very important to understand these insurances. Some patients, they come with Medicare and Medicaid, and they show you only the Medicaid. And you know why? Because they think, oh, Medicaid, I don't have to pay anything. For Medicare, you have to pay some. Because the Medicare pays 80%, and the patient is responsible for 20%. But because they don't know about these rules, they're going to play you, and they're going to say, oh, no, I have just Medicaid. And then when they receive the bill, because it's not going to go through, remember, because they know that Medicare is, and the insurance know that Medicare is the primary, but you did not present Medicare. You only report Medicaid. So that's why it is safe to ask the patients, do you have another insurance? particularly when you see that they are older than 65. Remember, older than 65, Medicare automatically. So assume so. So these are the things that we need to understand. We know that Medicaid is for people who has low income, right? It can be anyone at any age, but Medicare, no, it doesn't apply that. So if I see a patient that is over 65, more likely I see in it, looks like, or I see on their ID that says this is the age on the medical records, 35. And then you said, oh, wait a minute. You're not going to tell them, oh, what is your Medicare card? No. So do you have another insurance by any chance? And they're going to hesitate before they tell you no. So remember, some people just, they are not aware of this, or they're just going to play a little bit because they don't want to pay. Remittance advice. Remember, this is the summary. This is the statement that is being sent to the medical doctor. We discussed that at the beginning of, patients billing and collection. That's where we know exactly how much money we got reimbursed. And now we know what is the balance so we can send it to the patient. That's basically what it is. So this is the remittance advice. Remember, this is the statement that the insurance sends to the provider. Hey, I pay you for this, for this, for this, for this much. I didn't pay you for this. Rejected, rejected, deny, deny. So that's how it works. So keep it in mind, because that's something that, you need to understand. Explanation of benefits. Now I have right here a picture because this is what the patient is going to stop by the office for. Hey, I received this bill. But if you look on the bottom of this bill, I don't know if you have ever seen it. I've seen it 100 times, many times. I lost count because I have so many patients coming into the office and I have hear things and I go outside and I said, I have to explain sometimes to the patient because I get involved. He said, this is not a bill. Remember, this is a statement that is being sent by the insurance company to the patient, stating what services were provided to them and how much they were paid to the medical provider. So this is for the patient to be familiar, to make sure that, they review this and, verify that all those services actually were provided. Remember, this is to protect the insurance company. This is to protect the money from the government or whatever else. So avoid and medical doctors commit fraud by billing for services not provided. So that's basically what it is. So it's going to be name of the provider, day of the services, bill amount, how much the insurance pay for the services, what is the allowed amount, meaning what they pay, not the entire they allow, and then you have to deduct that because that's what you're going to receive to pay if that is the case. It says right here, the patient responsibility. So meaning what is the balance that you have to pay? Because they pay certain amount, but the total amount was this one minus what they pay. This is your balance. So you know exactly how much to pay. So you know exactly how much the office is going to bill you for. And again, if some of the services were not covered, they can explain it to you because you have to pay for those services as well, because the insurance did not cover them. See how it works? So this is what is important. And I definitely, recommend you to think about this explanation of benefits, because somehow I know you're going to have a patient walking into the office where you are working, and they're going to be, furious about this bill because they're going to see all amount of money that they're going to be charged, but they don't even read it. They don't understand it. and they think that they just receive a bill. And then you just gonna go there and look at the letter. And the first thing that you do, look at the bottom of the page. It's actually written in the envelope, but they're not gonna bring the envelope. So read it. It looks like a watermark. This is not a bill. So you calm down the patient. You don't tell them to calm down. Remember, that is the wrong thing that you can do. Said, oh, Mr. and Mrs. Smith, can you please follow me? Let's discuss this in private. Says, listen, this is some statement. This is all the things that, the services. Is this services was provided to you last time? Were you here? Did they do blood? Oh, yeah. Did they do? Yeah. Okay. So here in the bottom, it says this is not a bill. Don't worry, Mr. and Mrs. Smith. You don't have to pay it. As soon as you tell them, they immediately change and they are happy and they are leaving the place with no problems. So believe me, seen it many times. So just be nice to them because they don't understand. And nobody wants to pay bills. Remember, think about that. Think about you being the one who received this bill, but you don't know what is it. You think that you have to pay it. And this is a lot of money because the receives these bills for medical, they never cheap. So make sure that you do understand that. Encounter forms. Now, it is not 100% that you're going to get this question in your exam, but I have seen many students telling me, hey, they asked me for an encounter form. So what is an encounter form? An encounter form is this document, this statement that the medical provider completes when they are seeing the patient, because this is the statement that we're going to use to file for, the billing claim. From this encounter form is when we're going to get all the information to file that claim, CMS 1500 or whatever other claim that you use, depends whether it's a hospital or any other organization. So we're going to use this to get all the information so we can complete the claim form. That's basically what it is. So usually the questions are like this. You're a medical assistant and the billing department is asking you to find out what is the diagnosis for this particular patient. Where are you going to look at it? Or where are you going to get the information to complete the claim for billing services? Oh, an encounter form. And if you don't see the encounter form, because encounter form is the actual legal name, super bill are like nicknames that people give or the charge slip, but usually it's the encounter form. So whenever they're talking about where did you get the diagnosis, the information to complete the, this claim form, encounter form, this is it. There is no other document. Yes, we can get it from the medical records, but who's going to go over the medical records? Because here is very specific information. Here are all the codes, all the diagnosis, all the services are going to be marked right there. So why should I go read the medical records if you have this form with all the information? And this is the form that we give to the billing department. We don't give them the medical record. We just give them this, and that is it. Our medical record is protected. You only get this information billing department. So for that reason, it's so important to know. So don't forget this. Capitation. Now remember, these patients that are with HMOs and Medicaid, those insurance under Medicaid, they work under capitation. This is an amount of money that is going to be paid to the doctor. It's a fixed amount, monthly. This is not per visit. This is per month. So that's basically what it is. And if you are a participating provider and you accepted this capitation or these caps, that's it. That's all you're gonna get. You cannot bill the patient for the balance. That's it. Because this is Medicaid. This is the government insurance. If you look here, these are the rates. Remember that I mentioned that when I used to work there, they were paying like $27, $30. Well, it has not changed. This is a recent rate table for services. Here it says, you see, they pay $8, $30, $17 per month per patient. So that's very little money for the medical providers. But you know what? Quantity. So you have to see lots of patients to make up. Because remember, whereas for an adult visit, they pay us $27 per month or $30 per month, regardless of the amount of visits that they come to the office for. A private insurance pays us $200, just the cheapest. $200 just for the visit. Per visit, not per month. So think about it. Medical providers rather have, a private person. I can have 5, 6 patients per day. 6 times 2, it will be 1,200. But if I have 6 with capitation, how much it will be with the highest? 6 times 3, 18. $1,880. So again, it is just the way it is because it's capitation. So that's something that I want you to understand, that this is for HMOs, remember, Medicaid patients, because it's the government who's paying. So when the government pays, it's not going to pay a lot. So they're going to pay little so that we can get the services. But the services are provided. Even though if they are limited, still services are going to be provided. Okay, I think that we don't. Oh, COBRA. This is the last one. What is COBRA so important? COBRA is important for you, my students, because whenever you leave your job, or unfortunately you fire or you quit, or whatever the case may be, or they close, they lay you off, well, there is a chance to continue with your medical benefits. Now, I wasn't clear last time, and I want to clarify this. When I said that you can move to COBRA, so your employer has to tell you if they get rid of you, or if they fire you, or they lay you off, they're gonna inform you. Okay, hey, you're no longer gonna have a job here with us. So if you wanna continue with your medical care, so because they know that you have some medical conditions, then immediately you have to sign for COBRA. Remember, COBRA stands for Consolidated Omnibus Budget Reconciliation Act. So now that's what's important about COBRA, that you're going to keep your benefits. You're going to move your benefits because according to HIPAA, this is portability. Remember, you're going to move, portability means moving your insurance from this company, from this job to another job, or until you get something else. Something that I did not tell you or I wasn't clear about is, doesn't